Hello, seniors. I am Dr. Robert Harrison. Picture this. A frustrated patient walks into my office holding her vitamin D supplement bottle. She's been taking it faithfully for 2 years after her doctor told her it would help with her blood pressure, but nothing changed. In fact, her readings got worse. She demanded to know why. I looked at her routine and immediately spotted 5 critical errors that were preventing vitamin D from working. I'm Dr. Robert Harrison, and today I'm going to show you these 5 mistakes because research suggests many seniors are making at least 3 of them right now. One of these mistakes can interfere with blood pressure regulation and potentially reduce the cardiovascular benefits vitamin D should provide. Research suggests that when vitamin D supplementation is done correctly, blood pressure may decrease by an average of 2 to 6 points systolic. While this might sound modest, that's comparable to lifestyle modifications like reducing sodium or increasing exercise. The difference is vitamin D costs less than 50 cents per day and produces minimal unwanted effects when used properly. By the time we finish today, you'll know precisely what these 5 errors are and have a step-by-step approach you can discuss with your physician. Let's begin with mistake number 5, which catches most people completely off guard. Very few people know about this nutrient pairing. Mistake number 5 is taking vitamin D by itself without pairing it with vitamin K2. This isn't simply about reduced benefits. This error can potentially create problems by allowing calcium to accumulate in arterial walls. Picture this scenario. A 72-year-old discovers his vitamin D is critically low at 17 nanograms per milliliter. His doctor prescribes vitamin D and he takes it faithfully for 6 years. His vitamin D level normalizes to 36, but his blood pressure doesn't improve. In fact, it climbs from 146/86 to 158/94. Then he experiences chest discomfort. Cardiac evaluation reveals significant arterial calcification. His blood vessels have become rigid. Here's what was happening. Vitamin D increases calcium absorption from your diet, which benefits bone health. But that calcium needs proper direction once it enters your bloodstream. Without adequate vitamin K2, your body lacks the signaling to direct calcium appropriately. Calcium can begin depositing in soft tissues, including arterial walls. Vitamin K2, specifically the MK7 form, activates proteins called matrix GLA proteins that function like traffic controllers for calcium. These proteins guide calcium into bones where it belongs and actively prevent calcium from settling in arterial tissue. This mechanism is well documented in research. A 2013 study published in Osteoporosis International found that 3-year low-dose menaquinone 7 supplementation helps decrease bone loss in healthy postmenopausal women. Additionally, research published in the journal Nutrition, Metabolism, and Cardiovascular Diseases in 2009 showed that high menaquinone intake reduces the incidence of coronary heart disease. The solution is straightforward. Take vitamin D3 paired with vitamin K2 MK7. The dosage typically recommended in studies ranges from 100 to 200 micrograms daily. Many manufacturers now produce combined formulas. If purchasing separately, take them together. Research demonstrates this pairing doesn't merely prevent future calcification. Studies have shown that vitamin K2 supplementation may help slow or reduce existing arterial calcification. People supplementing with both nutrients show improved arterial flexibility and better cardiovascular outcomes compared to those taking D3 alone. This is not an optional enhancement. If you're currently taking vitamin D without K2, discuss adding it with your physician. Now let's address mistake number 4, which explains why many people supplement for months or years, but their blood levels remain disappointingly low. The issue is taking vitamin D without sufficient dietary fat for absorption. Picture someone who's been supplementing with 3,000 international units daily for 4 years. After 18 months, her level barely moves from 21 to 27. Her doctor increases the dose to 5,000 units. Another 18 months pass. Her level reaches 32, still suboptimal. She's confused and frustrated. The explanation involves basic biochemistry. Vitamin D is fat-soluble, meaning it dissolves in fat rather than water. Your digestive tract cannot absorb fat-soluble vitamins efficiently without dietary fat present. If someone takes vitamin D with plain oatmeal and black coffee, that meal contains essentially no fat. Most of the vitamin D passes through unabsorbed, but there's more specificity here. Research suggests the type of fat matters. A 2010 study published in the Journal of Bone and Mineral Research showed that taking vitamin D with the largest meal improves absorption and results in higher serum levels of 25-hydroxy vitamin D. Emerging evidence indicates vitamin D absorption may be enhanced when consumed with omega-3 fatty acids. Specifically, omega-3s may enhance absorption and reduce inflammation that can interfere with vitamin D receptors. A practical solution based on research is to take vitamin D with 1 tablespoon of fish oil or cod liver oil. The fish oil provides both the fat substrate for absorption and omega-3 fatty acids. In the scenario above, when this change was implemented, the vitamin D level increased from 32 to 61 within 90 days. Blood pressure, which had been stuck at 154/92, improved to 134/80, or over. Alternatives, if fish oil isn't tolerable, include a handful of walnuts or 1 tablespoon of flaxseed oil, both providing omega-3 fats. The key is omega-3 specifically, not random dietary fats. Taking vitamin D with omega-6 rich vegetable oils provides less benefit. Taking it dry with water means you may absorb only 20 to 30% of the dose. 1 tablespoon of fish oil or cod liver oil, or alternatively a small handful of walnuts consumed at the same time as your vitamin D supplement every day. This change alone can potentially double your absorption rate. Now we arrive at mistake number 3, which involves the actual chemical form of vitamin D that physicians often prescribe. The issue is taking vitamin D2 when you should be taking vitamin D3. Picture a 69-year-old whose vitamin D measures 14, severely deficient. His physician prescribes high-dose vitamin D 50,000 international units weekly. After 7 months, his level reaches 34, technically normal, but his blood pressure doesn't improve at all, remaining at 160/96. Here's the critical distinction. Prescription vitamin D is nearly always vitamin D2, the synthetic form called ergocalciferol. Pharmaceutical companies use D2 because it's patentable, but D2 is less effective than D3, called cholecalciferol, the form your skin produces from sunlight. Research demonstrates D3 is more effective than D2 at raising and maintaining blood concentrations. A 2012 systematic review and meta-analysis published in the American Journal of Clinical Nutrition compared vitamin D2 and D3 supplementation in raising serum 25-hydroxyvitamin D status and found D3 superior for increasing vitamin D levels. A 2004 study published in the Journal of Clinical Endocrinology and Metabolism found that vitamin D2 is much less effective than vitamin D3 in humans. D3 remains biologically active longer and binds more efficiently to vitamin D receptors throughout your body. For cardiovascular health specifically, research suggests D3 provides superior benefits. Studies comparing the forms found individuals taking D2 showed minimal blood pressure improvement even after levels normalized, while those taking D3 showed better outcomes across multiple health measures. In our scenario, switching from prescription D2 to over-the-counter D3 at 6,000 international units daily resulted in levels climbing to 64 within 8 weeks. Blood pressure improved noticeably over 12 weeks, dropping from 160/96 to 136/82. After 6 months, average blood pressure reached 130/76, allowing the physician to reduce one blood pressure medication. Check your vitamin D bottle right now. If it says ergocalciferol, that's D2. If it says cholecalciferol, that's D3. You want D3 exclusively. It's widely available over the counter at any drugstore or health food retailer and typically costs less than prescription D2. If your physician prescribed D2, have a respectful discussion about switching to D3. Let's move forward to mistake number 2, which is taking an insufficient dose to reach optimal blood concentrations for cardiovascular health. Picture a 74-year-old with vitamin D deficiency at 18. Her doctor prescribes 2,000 international units daily, a typical starting dose. After 14 months, her level reaches 37 within normal range. Her physician declares the deficiency corrected, but her blood pressure hasn't improved, still running 156/94. Here's the fundamental issue. Dosing recommendations doctors typically follow, generally 1,000 to 3,000 international units daily, are based on preventing bone diseases like rickets and osteoporosis. These doses maintain basic bone health. However, optimal vitamin D concentrations for cardiovascular protection may be higher than what's adequate for bones. A 2007 study published in the New England Journal of Medicine on the effect of calcium and vitamin D supplementation on bone density established baseline dosing for skeletal health. But research indicates meaningful cardiovascular benefits may require vitamin D levels between 40 and 60 nanograms per milliliter. A 2014 Mendelian randomization study published in Lancet Diabetes and Endocrinology examined the association of vitamin D status with arterial blood pressure and hypertension risk. To achieve concentrations in that range, most individuals may need 4,000 to 6,000 international units of D3 daily. Individual requirements vary based on body weight, genetics, baseline absorption efficiency, sun exposure, and other factors. In our scenario, increasing the dose to 6,000 international units daily while ensuring proper fat intake and adding K2 resulted in levels rising to 62 within 90 days. Blood pressure declined steadily from 156/94, dropping to 142/84, then to 134/78. After 6 months, she was averaging 128/74. Research demonstrates that when people raise vitamin D from deficient ranges to optimal ranges, blood pressure may decrease by an average of 2 to 6 points systolic. Some studies show slightly larger effects. This benefit appears to occur primarily when levels reach that optimal range. Most people require 4,000 to 6,000 international units daily to reach and maintain optimal concentrations. The only reliable way to determine individual needs is testing after 3 months of supplementation. Work with your physician to find the dose that achieves your target range. And now we reach mistake number 1, which involves when you take vitamin D. Emerging research suggests timing may affect how vitamin D influences blood pressure regulation. Mistake number 1 is taking vitamin D in the morning when nighttime dosing might be more beneficial for some people. Picture a 75-year-old taking everything correctly. D3 with fat with K2, proper dose of 6,000 international units. His level reaches 58, which is optimal, but blood pressure doesn't improve, staying at 164/98 despite 3 medications. Then he participates in a research study examining supplementation timing. He's randomly assigned to switch from taking vitamin D in the morning to taking it at night instead. Everything else remains identical. Over the following weeks, his blood pressure begins declining measurably. It drops to 150/88, then to 142/84. After 12 weeks, he's averaging 134/78. After 6 months of nighttime dosing, he's averaging 126/72. Why might timing matter? Vitamin D influences your circadian rhythm, which is your body's internal biological clock operating on a 24-hour cycle. When you take vitamin D in the morning, you're sending your body a signal that mimics what occurs naturally when sunlight strikes your skin in the morning hours. This may activate your sympathetic nervous system, which is your fight-or-flight stress response. This is completely normal during daytime hours when you need elevated blood pressure to support activity. But if you're taking vitamin D every single morning, you may be continuously reinforcing that daytime activation signal. Your body might not fully transition into nighttime rest mode. Most critically, your blood pressure might not decrease properly during sleep. In healthy individuals, blood pressure naturally drops by 10 to 15% during sleep hours. This nocturnal decrease is essential for cardiovascular health. Some research suggests that people taking vitamin D in the morning may experience impaired nocturnal decrease. People taking vitamin D at night before bed may show enhanced nocturnal decrease. Small studies have found that evening vitamin D supplementation was associated with better blood pressure outcomes compared to morning dosing, though this remains an emerging area of research requiring further study. The research on timing is still developing and not yet definitive. However, given the potential benefit and no known drawback to nighttime dosing, it may be worth trying if morning dosing hasn't produced expected results. Now you understand all 5 mistakes. Let me give you the complete protocol based on current research. First, form. Use vitamin D3, which is cholecalciferol, never D2. Second, dose. Consider 4,000 to 6,000 international units daily, though discuss with your physician as individual needs vary. Third, cofactors include vitamin K2 with your D3, specifically 100 to 200 micrograms daily of the MK7 form. This prevents calcium from accumulating in arterial walls. Fourth, fat. Take your vitamin D with 1 full tablespoon of fish oil or cod liver oil. These omega-3 rich fats enhance absorption. Fifth, timing. Consider taking your supplements at night before bed rather than in the morning. Make this your bedtime routine. Brush your teeth. Take 6,000 international units of D3 with 200 micrograms of K2 and 1 tablespoon of fish oil. Then go to bed. Sixth, monitoring. After 3 months, ask your physician to check your vitamin D blood level. You want to see a result between 40 and 60 nanograms per milliliter, though discuss your individual target with your doctor. Seventh, blood pressure tracking. Check your blood pressure at home twice daily for the first several weeks. Keep a written log. Most people may see improvements within 10 to 14 weeks. Eighth, medication adjustment. As your blood pressure improves, discuss medication adjustments with your physician. Never stop or reduce medications independently. A few important safety considerations. Vitamin D at these doses is generally safe for most people. However, if you have kidney disease, sarcoidosis, hyperparathyroidism, or certain other medical conditions, consult with your physician before taking higher dose vitamin D supplements. If you're taking blood-thinning medications like warfarin, discuss with your doctor before adding vitamin K2 because there can be interactions. Your vitamin D supplementation might be less effective for blood pressure support because of one or more of these 5 common errors. Correct all 5 factors and vitamin D may become a helpful tool for blood pressure support. If you found this information valuable, share this video with friends and family, subscribe to this channel for evidence-based health strategies, leave a comment sharing whether you were making any of these mistakes.